The Florida Department of Health raised safety concerns over baby formula. Governor DeSantis said 2/3 of the products they tested had elevated levels of heavy metals like mercury.
Cause for alarm, right? Well, we examined the data and found something different. Our chief investigator, Craig Patrick, discovered the state's own published results do not appear to support its findings.
When Florida government tested infant formula, it alarmed parents like Zoe Chase.
It just makes me think we're poisoning our children.
The Florida Department of Health collected 24 infant formulas and tested them for toxins. First Lady Casey DeSantis announced the results.
Of the 24 infant formulas tested, 16 of those formulas contained at least one, if not more, heavy metals that exceeded federal standards.
And you can see where parents like Zoe are alarmed by how Florida Surgeon General Dr. Joseph Ladapo described the danger of these contaminants.
So we're talking about neurodevelopmental injury. We're talking about injury to your kidneys, to your lungs, to your livers, to pretty much every organ in your body.
Those heavy metals the state tested the formulas for include arsenic, cadmium, lead, and mercury.
Mercury is probably one of the most toxic things that you can put into a person's body. Maybe followed right at the same level or just second by lead. So really terrible stuff.
But as we looked into the state's own numbers about that bad stuff, we may have discovered something else they missed: bad math.
Or really poor data entry.
We found data that does not appear to add up, and we asked Dr. Marie Bourgeois to review it. She's a toxicologist and chemistry professor at the University of South Florida.
I look at this and I'm baffled.
Let's start with Kendamil goat milk-based formula. The state did not flag it for exceeding limits on heavy metals, but it did release odd, if not impossible, results. It shows the average level of mercury to be 2.12 parts per billion, and the maximum level of mercury to be 1.22 parts per billion. On average, it appears to have more mercury in it than the maximum level of mercury they found in it.
So it doesn't make sense that you would have an average that's higher than your maximum. There would be I can't think of a mathematical way to get that.
Meanwhile, here's how the state flags certain formulas. It places a red circled letter representing each toxin on the products it claims to exceed maximum daily limits set by EPA and FDA.
We don't have a daily limit on anything. So I think it's a little confusing.
She said the federal maximum limits relate to chronic exposure. But putting that aside, Dr. Ladapo cited EPA's safe water drinking standards as the benchmark the state used in testing the infant formulas.
Beyond the EPA's safe water drinking standards, we're giving this to babies.
Well, Dr. Bourgeois said ready-to-use formula should be evaluated as food, and that formulas that have to be reconstituted or diluted with water could theoretically have contaminants in the water.
The EPA's method is strictly for drinking water, and these items, even liquid items, they're considered food. This is infant nutrition.
But also putting that aside, let's focus on the state results compared to EPA limits for drinking water, as Dr. Ladapo said.
And so we use that same standard for baby formula because, of course, babies drink it.
Here's how the state scored Similac Total Comfort Powder. It placed a red circled A for arsenic and a red circled M for mercury for exceeding maximum federal limits. Well, the state's results show Similac Total Comfort's mercury maximum is 0.36 parts per billion, which is lower than the EPA max drinking water limit of 2 parts per billion.
That doesn't come close to exceeding it, not based on the data that they're using or the limited data that they've supplied the public.
And while they placed a red mark on Similac Total Comfort Powder for a max of 0.366, they did not flag 6 other products the state results show as having higher levels of mercury than that Similac powder. Again, all of them are lower than the EPA limit of 2.
They're being inconsistent. I'm not entirely sure why they flagged the Similac, but if they're basing it on that value, then they left a few off.
Here's another example. Florida placed a red A for exceeding arsenic limits on Enfamil infant powder and Enfamil Gentilese Neuro Pro ready to use. But the state's results show they tested at 2.74 and 2.91 respectively. And both of those readings are below the EPA limit for arsenic at 10 parts per billion. And at the same time, the state did not flag other brands that, according to its own numbers, have higher levels of arsenic than those two it did flag. There's Enfamil Gentilese powder at 7.42, Enfamil Infant Concentrate at 6.17, and Kendamil Goat Milk at 7.09. Yet again, all of them are below the EPA arsenic limit of 10. But if 2.74 warrants a red warning label, why did the state give a pass to formulas with triple that amount?
Yeah, like I said, it's incredibly inconsistent.
And Zoe discovered another issue as a worried mom.
He is my pride and joy. He is very sweet.
She has to buy infant formula for her son Alex.
It's not everybody is able to breastfeed like myself, like other mothers.
And with money tight, she depends on WIC for help in covering the costs. That's a federal program for women, infants, and children administered by the state.
Because formula costs have gone through the roof.
Well, WIC only covers 4 specific types of formula. And when the state released its test results, it flagged 3 of them for heavy metals and did not test the 4th.
But they said more options were going to be available in the press conference to WIC families.
Then 1 month later, Florida did switch the options. But now all 4 of them exceed maximum levels on heavy metals according to its own scorecard.
It's not okay.
In the January news conference, Dr. Ladapo did say there would be different options for families that depend on WIC.
We'll be able to shift and make different decisions based on, the balance of their interests in the information that we're providing.
And First Lady Casey DeSantis thanked the Trump administration for working with Florida to make it happen.
And thanks to Secretary Kennedy and his team, Florida families will now have more formula options that will be covered by financial assistance if they choose to change their formula in light of these recent results.
But months have passed, and Zoe is still waiting.
I feel like nobody cares. Like that's what they're giving off right now, is that they don't care. They don't care because their children don't have to drink these formulas.
But that brings us back to the issues we found in the state test results and closing thoughts from Dr. Bourgeois.
You've already pointed out the inconsistency with labeling. Without being able to see anything about what testing methods they use, the number of samples, all of the study setup, I can't say that I would rely on it. No, I would say that if you are concerned, look at the FDA's total food study.
Well, the FDA tested 312 samples of infant formula and published its findings in April of 2026. All of them were at least 2 times below the EPA drinking water requirements for arsenic, at least 3 times below the EPA drinking water requirements for cadmium, at least 6 times below requirements for mercury. In fact, 95% had no detectable mercury, and all of them were at least 8 times below EPA drinking water levels for lead. We requested an interview with the governor, the First Lady, and Dr. Ladapo to discuss their methods, their protocols, and verification of their numbers. After we emailed that request, the state removed those numbers from its website. We are still waiting for a response. Craig Patrick, Fox 13 News.
Thank you, Craig. We are all anxious for a response now. Well, we've got a link to the full FDA results and more on the state's testing, fox13news.com. As we say in the TV business, stay tuned.
Yeah. Wow.